Hi everyone, this is the Introduction to Clinical Anatomy. We are going to look at the various approaches to anatomy, the major organs and structures present in each of the 11 body systems, the anatomical terms used for body regions, planes of section, directional terms, body cavities, and serous membranes. This should be a really good review for any of you who have already done general anatomy or who have done it recently. If it's been a while or you haven't done general anatomy in the past, this will be a good way for you to familiarize yourself with some of the basic foundational language that we will use throughout anatomy study. So anatomy for clinical practice is really necessary for a thorough and accurate physical exam, identifying the major structures present in the body, and also being able to then use the major terminology to communicate with other practitioners and also in your clinical notes. It's important for creating a focused history because if you know what structures are located in a particular region of the body or what structures send referred pain to particular regions of the body, then that's really helpful for focusing your physical exam, focusing your history, and also creating appropriate differential diagnoses. Also very helpful to acknowledge individual variation. So where that is present, I will do my best in these anatomy modules to talk about individual variation in structures and organs, organ location, or particular variants that are unique across individuals. So we look at the types of anatomy. There's many different types of anatomy. Gross anatomy is really the study of large structures, structures that we don't need a microscope to see. And there's a lot of different ways to approach gross anatomy. So first of all, if we look at surface anatomy is really looking at what we can see on the surface. And this is important as a foundation for looking at physical exam because it's the prominent bony structures, the prominent muscles, superficial muscles, prominent blood vessels that you're going to use to help with your physical examination procedures. Regional anatomy is by body regions, so head, neck, upper limbs, thorax, abdominal, pelvic, etc. Systemic anatomy is based on organ system, of which we generally have 11 organ systems, and we'll go through those in a minute. And then finally, developmental anatomy can be really helpful for understanding some of the interesting disease conditions, interesting variations, and also a lot of the terminology related to the anatomy you will be learning. Microscopic anatomy we're not going to be dealing with very much in this course, but it can be helpful in some cases for looking at cellular anatomy, that's cytology, and tissue anatomy, that's histology. So anatomical terminology is really about getting some of the basic language of anatomy. And in this next couple of minutes, we're going to talk about structure and function of the major organs and organ systems, anatomical position, body regions, sectional planes, directional terms, the body cavities, and the serous membranes within the body cavities. At the end of this lecture, I would also highly suggest that you review the osmosis video on anatomical terminology. It's a great video and it's going to repeat some of what we're talking about here, but also provide some nice additional visuals. So let's first look at the organ systems, of which there are 11. I would like for you to know the major organs and the functions of each organ system. So first, we look at the integumentary system, which is skin, hair, sweat glands, and nails. The skeletal system, which is bones, cartilage, associated ligaments, and the bone marrow. The muscular system, which is skeletal muscles and associated tendons attaching the skeletal muscles to the bones. The nervous system, which includes the brain and the spinal cord in the central nervous system, and the peripheral nervous system, which includes sensory organs. The endocrine or hormonal system, which includes the pituitary gland, the thyroid gland, the pancreas, adrenal glands, gonads, reproductive gonads, that's testes and ovaries, and then the endocrine tissues to other systems. Cardiovascular system, which is heart, blood, and blood vessels. Lymphatic system, which is spleen, thymus, lymphatic vessels, lymph nodes, tonsils. We will also study the appendix and the red bone marrow when we study the lymphatic system. Respiratory system, which is nasal cavities, sinuses, larynx, trachea, bronchi, lungs, and the final air sacs, the alveoli. The digestive system, which begins in the oral cavity with the teeth, tongue, the pharynx, and then down the esophagus to the stomach, small intestine, large intestine or colon, the liver, gallbladder, and pancreas. The urinary system, which includes the kidneys, ureters, urinary bladder, and urethra. And then our two reproductive systems. For the male reproductive system, it's the testes with the reproductive tract, epididymis, ductus deferens, and the accessory organs, seminal vesicles, prostate gland, and then the external genitalia, penis and scrotum. And then major organs for the female reproductive system, the ovaries, and then the tract from the ovaries, uterine tube, uterus, vagina, and then the external female genitalia, which are the structures of the vulva, the labia, and the clitoris. And then often when we discuss the female reproductive system, we will also talk about breast tissue and the mammary glands. So those are the 11 major organ systems. Now let's talk about some anatomical terminology that we'll be using. So first, all anatomical directions and terms are given with respect to anatomical position. So anatomical position is just as shown here, which is body straight and upright, feet parallel and slightly apart, arms to the sides, arms laterally, palms facing forward, and thumbs pointed away from the body. What's important about anatomical position is that structures are always referenced with relation to their anatomical position, no matter which position the patient or the body is actually in. So that, an easy way of saying that your right hand is always your right hand, even if it's over on the left side, because we're always saying it with reference to anatomical position. Sounds simple, but sometimes it gets confusing, so remember that. I'm also going to ask you to learn all of the major terms related to the body regions. This is really going to help you as you move through your physical assessment courses and also through any anatomy course, because many things are named by body region. So you're going to see the roots of body regions in a lot of the naming of structures coming up ahead. So, for example, did you know that you have two biceps in your body? Biceps means a double-bellied muscle. So generally, when we might say biceps, we're usually talking about the biceps in the arm, but you actually have two biceps. So biceps brachii and biceps femoris. So biceps brachii has the root regional term of brachial, which means that the biceps brachii is in the arm. Biceps femoris has the root word femoral in its name, so that tells us that the biceps femoris is found in the thigh. I want you to pause and take a close look at this diagram, which names and locates each of the regional terms. Start with the anterior view, and you'll notice in parentheses that there's a definition of each term. So, for example, mental, is the term for the chin area. So in this diagram, it points to the chin, it names it mental, and then in parentheses, it gives you the definition, chin. Another example, antebrachial. Antebrachial points to the forearm. So that is the forearm region, and then in parentheses it says forearm, so it's defining that term for you. So take 5 minutes, please, here to pause. Look at all of the regional terms related to the anterior view, all of the regional terms in the posterior view, and expect a quiz on these coming up later. We also have abdominopelvic regions. The abdominopelvic regions are divided up in 2 different ways. They're divided up either in the abdominopelvic quadrants, which means we divide them up into 4 different regions, or into the 9 abdominopelvic regions. Both of them center the abdominopelvic regions at the umbilicus, or the umbilical region, which is the center where the belly button is found. Let's first look at the abdominopelvic quadrants. Those are very simple. So those are centered at the umbilicus, or centered in the umbilical region, and you would simply draw a imaginary line centered at the umbilical region. And then we simply say the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. You're going to want to know for each of these what organs are present in each quadrant. These are very, very commonly used in documenting regions of abdominal pain, for example, and helping to define what organs you might be thinking of if a patient, say, has right upper quadrant pain. What organs are present in each of these quadrants? So take a moment to try to remember, starting at the belly button region, all of the organs that are present in the right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. And then make sure that you're also paying attention to female versus male anatomy, because when we're looking at abdominopelvic regions, we need to think about the digestive organs, we need to think about the urinary organs, we also need to think about the reproductive organs and major blood vessels. The abdominopelvic regions are less commonly used in clinical note-taking, with the exception of the epigastric region is very, very common. Hypogastric region, especially looking at suprapubic areas for documenting where the bladder or bladder-associated tenderness might be. But it's not as common to use the 9 abdominopelvic regions. I do want you to know these, though, generally, because these terms may come up. So the hypochondriac regions are just below the ribs, hypochondriac, below the ribs. In the middle of the hypochondriac regions are epigastric. Epi means above, so epi is just above the stomach, epigastric. Umbilical, we've already said, is centered on the belly button. When you're looking at this view where you can't actually see the belly button, you can kind of think of drawing a line approximately at the location of the center of the transverse colon. And then on either side of the umbilical region, we have the lumbar regions. Below the umbilical region, we have hypogastric region, below the stomach. And then on either side of the hypogastric region, we have the iliac regions. Next, we have planes of section. These are going to be very important when you're looking at imaging. Different imaging modalities and different imaging views will use these planes of section. So a frontal or coronal plane is made, I always remember, as sort of as a crown sits on the head. So a coronal plane is in this direction here, and this one is notating the coronal plane. A transverse plane is transverse across the body, or making a transverse cut across the body. And then a mid-sagittal is going down the middle. A sagittal section is exactly perpendicular to a coronal section, and mid-sagittal is exactly in the middle, perpendicular to the coronal section. So this is mid-sagittal, this is coronal, and this is transverse plane. Here's some examples of what those imaging might look like if you have imaging of the brain, for example. So the coronal section, the mid-sagittal section, and the transverse section. And you will choose different imaging depending on the structures that you're hoping to visualize at the time. Next are directional terms. So we use directional terms to describe where structures are in relation to other landmarks or regions in the body. So we would say, the nose is above the mouth but in between the cheeks. And if you wanted to then use the proper directional terms, we would say the nose is superior to the mouth, meaning above, and medial in the middle of, or more towards the midline of the cheeks. We can get fancy and do both directional and regional terms, and we would say the nasal region is superior to the oral region, but medial to the buccal region. So you can see how if these terms are new, it sounds like a completely different language, but really if you break them down and get used to using them, it's very simple. It's just slightly different terminology. So it's important to use the anatomical terms in your notes to make sure that you're communicating with other healthcare providers so that you're all talking about the same thing. Here's an example of each of those directional terms: anterior towards the front, posterior towards the back, superior above, inferior below, medial towards the midline, lateral towards the sides, away from the midline. Proximal and distal are generally used for limbs, and proximal means closer to the body attachment, and distal means further away from the body attachment. So, for example, if we're looking at the upper limb, the body attachment is where the shoulder meets the shoulder girdle. So the attachment of the upper limb to the body is at the shoulder girdle. So everything then is in relation to the attachment of the body. So if we're saying that the wrist is proximal to the fingertips, meaning that the wrist is closer to the attachment point of the body than the fingertips, but the fingertips are distal to the wrist. They're further away from the attachment point on the body. Sounds a little tricky, but it takes some practice, but get used to using proximal and distal. You'll use them a lot in the musculoskeletal unit and also in relation to different injuries. Okay, finally we have body cavities. Body cavities are spaces lined with specialized tissues that secrete fluids and keep those spaces lubricated. So we have the ventral cavity, which is anterior or more towards the front of the body, and then we have the dorsal cavity, which is posterior. The ventral cavity can be divided up into the thoracic cavity and the abdominopelvic cavity, and the dividing line for the thoracic to the abdominopelvic cavity is the diaphragm. So the thoracic cavity is above the diaphragm, the abdominopelvic cavity is below the diaphragm. The dorsal cavity is composed of the cranial cavity, which houses the brain, and the vertebral canal, which houses the spinal cord. If we look at this diagram, we have a few additional cavities that we want to mention within the thorax and the abdominopelvic cavity. So within the thoracic cavity, we have the pleural cavity for the lungs, and the mediastinum, which contains the heart and several other nearby structures. Within the mediastinum, we also have the pericardial cavity, which is the specific location of the heart. The sac around the heart is the pericardial sac. And then within the abdominopelvic cavity, we have the abdominal cavity, which is above the pelvic brim, and the pelvic cavity, which is below the pelvic brim, found in the true pelvis. The serous membranes are the membranes that are lining the body cavities, and they are named for their location either on the wall of the body or on the organ, and they are named for which cavity they're in specifically. So parietal means on the wall or off to the side. Visceral means on the organ. So if we look at the lungs, for example, the parietal pleura are found on the chest wall, and the visceral pleura are found on the lungs themselves, and then the space containing the pleura is the pleural cavity, and that contains the pleura and the lungs, of course. Same for the pericardium. We have a parietal and visceral pericardium, and the peritoneum is the serous membrane that lines the abdominal cavity, and that also has a parietal and visceral segment as well. So remember, parietal is along the wall, visceral is on the organ themselves, and we have the pleura, which house the lungs, the pericardium, which houses the heart, and the peritoneum, which is surrounding certain digestive organs. And we'll learn about those digestive organs a little bit more when we study the digestive system and which organs are within the peritoneum and which organs are retroperitoneal or behind the peritoneum. This is a more detailed view of those serous membranes. Again, when we get to the digestive system, we'll learn a little bit more about the serous membranes within the peritoneum. For example, the different mesenteries and the ommenta. More on that to come. All right, that's it for this. Let me know if you have any questions.